Hey, we're here with Austin. He had a pretty cool, what I call a pretty cool injury. So he was doing lifting up a table, doing his job as a supplement rep, and felt a little bit of a strain over here in his trap. And then a couple days later, he trained legs, then he trained his chest on a following day, and he noticed that his shoulder didn't feel right. Okay, so I'm going to show you what we found and how we're looking at it, not just from an isolated shoulder point of view, but how we actually fix it. All right, so we did our standard checks with Austin. Now we're going to isolate a little more to the shoulder. So we're going to go to above head shoulder. We're going to check for subclavius. Hold strong. Good. And then we're going to go into just pulling his palm down, and he's weak there. All right. But if we use it outward and try lower trap, he's nice and strong. All right. So now we're going to go into supraspinatus, and I'm going to pull him directly to me. There he goes, weak again. All right. So we know that there's a little bit in supraspinatus. We're going to check our delt 2 right here to see if and it's a little bit weak, but not too bad. I'm going to see if there's a forearm involvement or a neck involvement. So go ahead and make a strong fist, and it makes it stronger. So for this weakness in the supraspinatus, he's actually using his forearm to compensate. That's okay. Now we're going to see if there's some neck involvement. I want him to grit his teeth pretty hard, and then all of a sudden it drops. So we know there's some neck involvement. Okay? So this is how we're going to look at why the neck is involved and go from there. All right, so we know the right shoulder is involved. We've got to figure out what else is involved. We're going to look into lat and find out why that trap wasn't doing its job. We're going to check the lat, and sure enough, that right lat is nowhere to be found. Now, so anytime you have a right lat weakness, we've got to look into the pelvis, and we find out because the lat is attached at the pelvis, an anchoring system. So we're going to check a few legs in the pelvis to find out what's going on. And we're going to do glute medius, hold it, and glute medius over here, and there's his weak spot. All right, so this is what we're looking at. He's got a glute medius weakness, so he's not stabilizing the glute medius, which is going to go into this lateral line and allow this lat not to stabilize as well. That lack of stabilization in the lat allowed this upper trapezius to get a little hyperactive because he did not have his balance here, and that's the reason why. Pulled on that neck a little bit, create a little bit of C6 segmental dysfunction, shut down that supraspinatus a little bit. That's why he didn't feel too much when he picked up the table. He only felt it when he did his bench press. All right, so we know that we found out that his pelvis is the one that's causing it. We're going to go with medius. We need to go to L4. We need to figure that out. Then this thing, quick little adjustment, and then we're going to retest. All right, quick little retest. Let's see if that glute medius actually fired up. Hold it out. That is much stronger. All right. Now, let's see if the lat's stronger now. 1, 2, 3. Lat is super strong. Okay, so let's talk about how much influence the pelvis is to the shoulder. You would think that it's a purely shoulder injury, but we want to see how much influence it came from the pelvic instability. So we're going to set him up. All right, so now we're just going to retest the exact same things before we actually treat into the shoulder joint. I'm just going to go through the retest and see if there's any change, even though we didn't even touch the shoulder. So let's go all the way up. Let's go just palm forward, and we're going to pull. He's a heck of a lot stronger, right? We're going to turn here. I'm going to come in through this way. Significantly stronger. Big difference, right?
Big difference.
All right, so then right here, we're going to look at this guy, completely stable. So now we know this is much more stable. Now we can do some treatment. We're going to just release this trapezius. We're going to release a couple muscles, make sure he's stabilized with a little bit of movement and a little bit of stabilization training, and he's on his way. The problem wasn't in the shoulder. The problem was down in the pelvis, and it was illustrating itself in the shoulder due to a segmental dysfunction and a little bit of lack of stabilization. And that's how we fix shoulders here. All right, so we've been doing scraping just evenly all the way through, and where came up with the most superficial adhesion? Right there. What is that in line with? Guess what? That's C6. What? C6? What? That was what we said. All right, so when we tested, what did we see? We saw supraspinatus being weak, but lower trap wasn't. All right, so now we're going to check some of myofascial adhesions. Guess where we found the best juiciness right here? Lower trapezius. Then also, because his lat wasn't working, guess what? This little lat attachment that's along the scapular border and how it, fuses into serratus and posterior and the lower trapezius, that's where his fascial adhesion is. Why? Because the fascial adhesions are trying to anchor it, because supraspinatus wasn't doing his job, lat wasn't doing his job, other people weren't doing the work, so therefore your body's going to create some fascial adhesions to anchor it. The body's cool. Now we're just drilling it in. We're just creating multi-vector movements and using his body to create different force vectors along this, and we're going to solidify that joint. Now how does it feel?
Feels good. It's activated.
Right? I'll hold
Right.
it up and I'll show you. Just like crazy.
Yeah.
Cool.